Thank you very much. It's well, that's the Hunkaminam word for a good day. And we are here this morning on the ancestral and unceded territory of the Coast Salish. It's the shared territory of the Musqueam, Tsleil-Waututh, Katzie, Stolo, and also Coquitlam. I'm pleased to have the opportunity to welcome some of our very important healthcare workers and also the leader of the NDP, Jagmeet Singh. Over to you.
Thanks, Bonita. We're so happy to have you on the team and to have you representing Port Moody-Coquitlam and fighting for the good people here. We're joined by two healthcare workers, two nurses. We've got Sarah and Mark that are here with us. And we're here to talk about what's been going on throughout the pandemic and before. Our healthcare system has been underfunded chronically for decades. And as a result, healthcare workers have been put to the brink. I've heard countless stories from healthcare workers who are burnt out, who are exhausted, who are overworked. And despite that, they continue to provide care for their patients and they continue to provide care for our loved ones. But we need to be there for them. So we're calling on the federal government to stop the trend of underfunding healthcare, to increase funding, to properly fund our healthcare system. We've seen countless times in this pandemic that our healthcare system was at the brink of collapse. That should never be the case. That should never happen. And we know one of the reasons for our healthcare system being pushed into this point of peril is because it's been underfunded. So we need to see proper funding at the federal level, support our healthcare workers, invest in our healthcare, keep it public, keep it well-funded, and make sure if our loved ones need care, we don't have to worry about receiving the care that they need. And that's what we're here to talk about today, how we can help out these healthcare workers, how we can help out families, how we can invest in a publicly delivered healthcare system that's well-funded. Donc aujourd'hui, on va parler de la crise dans notre soin de santé. Ce qui est clair que nos travailleurs de santé ont fait face des grands problèmes depuis le début de cette pandémie. Mais le fait qu'on a vu des problèmes dans cette pandémie, c'est le résultat des décennies de manque de financement du niveau fédéral. Et on veut arrêter ces manques de financement. On veut augmenter les transferts en santé pour mieux financer notre soin de santé. C'est clair qu'on a vu à plusieurs reprises notre système de santé en péril de s'effondrer. On veut arrêter ça. On veut prévenir ça. On veut s'assurer que notre soin de santé reste public, entièrement public et bien financé pour aider les gens quand ils ont besoin. On va aujourd'hui entendre les histoires de Sarah et de Mark qui vont partager, de Sarah qui va partager ce qui se passe pour les travailleurs de santé. Thanks again for being here. And now I'm going to pass the mic to Sarah, who will talk about what it's been like in the pandemic and in general for healthcare workers. Thanks so much for being here, Sarah. Pass the mic to you.
Thank you very much. My name is Sarah Mann, and I'm a rehab assistant for the past 19 years. I'm also a union steward. For the last 2 years, Public Health has celebrated healthcare workers for their courage, their commitment during the pandemic. But every day, I hear from our healthcare workers who are short-staffed, who are struggling with their mental health, and who are burnt out. Healthcare workers are exhausted. They need help. Many people I talk to on an everyday basis are looking to leave healthcare altogether. There was a healthcare worker shortage before the pandemic, and it's become more obvious, and it's evident that there are just not enough hands on deck to get the job done. People are working extended shifts more often, and it takes away from their work-life balance, takes away from the time they have with their families and their friends. We have a serious workload issue, and it's only going to get worse if we don't get it addressed. Healthcare workers are also struggling with their mental health. It's hard for them to cope at this point. For so many of the frontline workers, they have PTSD, a direct result of this pandemic, especially in the hospital and the long-term healthcare workers sites. They're experiencing death in numbers they've never endured in their careers. Some days it can feel like our healthcare system is falling apart. Our growing community relies on a healthcare system and we're not keeping up. We need to make key investments in our frontline workers so our healthcare system is sustainable for the near future. We need the federal government to put words into action and invest in our skilled and experienced healthcare force. I know our provincial government has invested a lot of resources to our healthcare during the pandemic, but funding these services are a shared responsibility in the federal government and the provincial. Our premier has been calling on the federal government to step up and increase its contributions to the cost of healthcare, and believe the federal government should listen to the premier and Jagmeet and pay a greater share. I believe the federal government needs to step up to the plate, provide better support to the provinces of our healthcare needs. Thank you.
Thanks so much, Sarah, and thank you to Mark for being here. This is the reality. We need to see a properly funded healthcare system, and we've known that for decades the federal government has not done its part; it's been cutting funding. That funding has been going down, and it's meant that provinces have been left to pick up the pieces. And as a result, our healthcare system has been underfunded. And we've heard from healthcare workers, they are feeling the brunt of this. They're overworked, they're exhausted, they're burnt out. And as Sarah said, many are leaving the profession that they love, that they spent their life training for and want to continue to serve in, but are unable to do so because they're so burnt out, PTSD and mental health. And we can fix this. The fix is properly funding our healthcare system. Properly funding it from the federal level will go a long way to making sure we have a properly funded healthcare system that's there for people when they need it, and so our healthcare workers are supported. With that, we're ready for any questions that the media might have. I want to again thank Sarah and Mark for being here and for sharing a story that reflects the story of so many healthcare workers. Thank you.
Thank you, Jagmeet. We will start with James on the ground, who will take questions from people in person, and then we will move to questions on Zoom. For folks on Zoom, use the raise your hand function. You will have one question and one follow-up. On va commencer avec les questions en personne. James va prendre les questions sur le lieu et ensuite on va passer aux questions Zoom. Vous allez avoir une question puis un suivi. Over to you, James, for questions on the floor.
The put a sanction on Russia and has allocated more money to help the Ukraine, and that's now on the COVID. Your thought on whether they will have to or do more.
What we're seeing in Ukraine is a humanitarian crisis on a scale that we've not seen in our lifetime. The sheer violence, the amount of people displaced. Tallies have it over 1.5 million people have left the country because they're fleeing war and the violence and the threat of death. So we need to do everything we can to support people in this crisis. It also reminds us of our responsibility to support refugees and people fleeing crisis around the world. But right now we know that two of the most important things we can do: welcome people that are leaving this war, that are seeking refuge and solace. And what we can do is make sure that that is for anyone leaving Ukraine, whether it's a student, whether it's someone that's not a Ukrainian citizen, anyone that's fleeing this war has to be welcomed in Canada. We need to step up and provide supports. We also need to provide humanitarian support to people on the ground and to neighboring countries, which are doing an incredible job of welcoming people. We also need to continue to apply sanctions on Putin where it matters most. We've been ramping up the call for sanctions on the oligarchs, the specific ones named by Alexei Navalny. We know that there are oligarchs that are holding the wealth of Putin, and the best way for us to apply pressure financially on Putin is by attacking his wealth, and that's by seizing and freezing the assets of his closely affiliated oligarchs. There's also a piece of legislation that's being brought forward in the Senate, which would allow for more ability to seize and freeze assets and then to repurpose them to support people in need. This is something that we support as well. We need to be firm on sanctions against Putin, and we need to provide humanitarian relief.
Do you think we should allocate more money to the healthcare system?
We believe that we can do both. That we absolutely can fund our healthcare system properly. Supposed to be a partner in our healthcare system and has failed to do that job. They have been cutting funding for decades. Conservative and liberal governments have been doing that, and we need to stop the cuts and we need to invest properly in our healthcare system. So that has to happen. It's the long-term goal, and that has to happen immediately. In terms of what's going on in Ukraine, we need to step up as a part of a global citizen, as a part of being global citizens. We need to do our part to support the people in Ukraine. And we absolutely believe that that means stepping up with financial funds, with receiving people that are seeking refuge, and doing our part as the world has to do to support people in need.
The gas is at 214 cents today. The premier is at what is our government doing? But this government that is not a solution. In your opinion, what is needed to be done to control and bring down the gas prices?
Well, gas companies shouldn't be able to make a profit off of a crisis. They shouldn't be able to gouge people off of this crisis. What we're seeing right now is that oil executives and gas companies are basically exploiting a situation, and that should not happen. So what we're proposing is we need to make sure that no one makes money off of the inflation, that they're not profiting off of the struggles of people. So what we're calling for is an excess profit tax, that those companies that are making increased profits, that we need to make sure we're taxing them and reinvest that into supporting people, into the cost of living. Why is it that when the cost of goods goes up, that grocery store or corporate grocery store owners and large corporate oil and gas companies make record profits and people suffer? That should not be allowed to happen. And so we're calling for a tax on those that are making profits in this time and reinvest that back into supporting people. The cost of living is going up. I'm hearing so many stories from people that are struggling with the cost of paying for gas, the cost of paying for their groceries, and we need to step up and provide real solutions. I know this is not specifically the fault of any one policy at this point in time, but a leader is someone who steps up and says, if people are suffering, we need to find solutions. And there are solutions there. We can make sure that those at the very top pay their fair share, that we invest that back into people. And that's what we're calling for. Hey there. So if anyone needs help, always feel free to reach out to our office in Burnaby. We're there for folks in Burnaby South. Our office is on Kingsway. And what we're doing is we know that there's a significant Ukrainian Canadian population. And I've spoke with a number of those communities, the Ukrainian Canadian Congress, as well as students in a student association for Ukrainian students, as well as Ukrainian citizens that have made Canada their home now. They've talked about how they want to be there for their family members, they want to be there for their friends, but they're unable to do so because of the current legislation or immigration rules. So we're pushing for a number of changes. We want to make sure that we expand the definition of family so that if someone wants to sponsor a cousin or an uncle or an aunt, that they are also able to do that. There are a significant number of people in Canada that are willing to sponsor family members and friends. They need to be able to do so. We need to work closely with all levels of government. And so what we're calling for is a national plan. We can't have NGOs, community groups, provinces, municipalities, territories, and the federal government all working separately. We need a concerted plan that's cohesive, where we all work together to clearly lay out a path where we can provide easy, straightforward supports to bring Ukrainians to Canada and to support the Ukrainian Canadian population that wants to do its part as well. So that's what we're calling for, a clear, comprehensive plan to work with all levels of government to deliver that support to people. What we put forward is that we need to do exactly that. This can't be a plan that's just federal focused, and then we leave provinces and territories and municipalities and frankly NGOs to do their own thing. The best way we can provide help is if we're all coordinated. And that's why we're calling for a national plan, where we bring together the provinces and territories, the federal government, of course, with the immigration rules, as well as municipalities and NGOs, to have that clear plan that is coordinated, that can work in a way that's more effective. If we leave it in a piecemeal approach where everyone's working on projects separately, we're not going to be able to have the biggest impact. And that's why we're calling for that national plan.
Great. We will move to questions on Zoom. Nous allons passer aux questions sur Zoom. La première question que nous avons, the first question we have is Laura Osmond from the Canadian Press. Laura, go ahead.
Hi there, can you hear me?
Yes.
Perfect. A group of about 40 healthcare worker organizations had an emergency summit last night to discuss burnout and what needs to be done to improve the healthcare system. Certainly they all agree that more funding would be great, but they also said that the federal government needs to take a stronger hand in fundamentally revamping our healthcare system with major reforms. Otherwise, we're just going to continue to fund a broken system. So you're saying that funding is a major part of it, but what other steps do you think need to be taken in tandem?
Really appreciate the question. I can't underscore enough how funding is very, very vital. We know that a large problem is the fact that there's been underfunding, and having the federal government continually cut, not just maintain, but be cutting healthcare funding over the past number of decades has absolutely contributed to the crisis that we're witnessing right now. And I can't underline enough how important it is for us to properly fund our healthcare system, and the federal government has to step up and provide that funding. That's a message we're sending loud and clear to the federal government today. But in addition, we agree that there are certain things that need to be improved without a doubt. And that's why we called for national strategies around things like long-term care. We know that long-term care has significant challenges and that there are best practices, and we can work together to develop what those best practices are, learning from what has worked in some provinces and what hasn't worked, frankly, in other provinces, putting that together to develop a national plan around long-term care. But that can apply for healthcare delivery, broadly speaking. We know that there's been significant attacks in other provinces on a publicly delivered healthcare system, that the encroaching privatization is happening. That is a serious threat to having a healthcare system that's there for everyone when they need it, no matter how much they earn. We also know that with the advent of the necessity in the pandemic of telemedicine and digital medicine, we need to find ways to deliver that care in a meaningful way and in a way that works best for everyone. We know that there's additional issues around access and lack of access where there's not internet connectivity, and how that impacts rural health. So having a national strategy on how we can deliver healthcare better, how we can support healthcare workers better, and in specific areas like long-term care, these are very vital. But it also underlines another really important aspect, is why we've been calling for expanding our healthcare system to include things like pharmacare, mental health, and dental care. We know that our healthcare system needs to be expanded to cover everyone from head to toe. And the addition of medication coverage would significantly improve healthcare, lower costs, and provide better care. So there's lots that we can do where we could coordinate and develop a better healthcare system, a better model of delivery, and we're absolutely open to that.
Thank you so much. I also wanted to ask you, the Commons Committee on Health is studying the health resources sector in terms of human resources. And a lot of people who have been testifying at that committee have been calling for a health human resources strategy, even an agency that would be responsible for making sure we have the right people in Canada in the right place to fill the need, given all the attrition we've seen. Is that something that the NDP supports?
We've been calling for significant changes to make sure that we provide where we have enough healthcare workers that can respond to the needs of people. So we absolutely believe in that. That's something that we support. A specific measure that we've called for, we've found, and I've done a press conference with a significant number of internationally trained healthcare workers that have completed their training in Canada, and the only barrier to their ability to practice is their immigration status. That should not be the case. It should not be that immigration status is a barrier for internationally trained healthcare workers to be able to work in Canada. They should be able to contribute to the fullest of their training. So that's a significant problem. But in general, the question around how do we connect the skills and the capacity of people with the needs in Canada is something that absolutely New Democrats support developing a better plan around. And one of those examples would be to have a better immigration system that responds to the needs of bringing healthcare workers to Canada and then acknowledging their status so that they can work here. That's something that we absolutely support.
Bonita, did you have anything to add on that, or are you okay?
Do you want to?
just take this opportunity. Thank you very much. Thank you very much. I'll just take this opportunity to say that on the Standing Committee for Human Resources, Skills Development, and Disability and Inclusion, we also have a study underway. It's a study that I brought forward to the committee where we are going to look at the labor shortages and some of those barriers, and also how to support healthcare workers across the spectrum. Thank you.
Thank you, Bonita. Next question, we have Jeff Labine from iPolitics. Jeff, go ahead.
Good morning. Can you hear me? Hello?
Yep, we can hear you. Yeah, yes, we can hear you.
Good. My question's around increasing military spending, just given everything that we're seeing in Ukraine. Is that something the NDP would support? And if so, what would you like to see in the upcoming budget in terms of increased spending?
I want to take this question very seriously, and it's a very important question. New Democrats have been taking a position that we need to be a voice for peace, that in what we're seeing around the world, we know that the cost of war is staggering. We've seen horrible images, horrific images of maternity hospitals being bombed, of civilians being killed. We don't want to contribute to anything that will increase tensions, and we take this very seriously. As a party, we want to be a voice for peace, and that's why we've been advocating tools that will help us de-escalate, specifically targeting Putin with economic sanctions, fierce sanctions that go after his wealth, that go after his money, is a way specifically to target him and to put pressure on him to end this war. We've been calling for humanitarian relief, whether it's dollars spent on the ground to support people in Ukraine and the refugees fleeing across the border, or whether it's providing support to people to come to Canada. That's been our approach. We take it very seriously. We understand that this is a serious war and that there's a serious toll that's being paid. And our voice is one that we have to continue to push for a peaceful resolution, a de-escalation. As hard as it is to do that, we know that the cost of war is only going to increase. The loss of lives will only increase unless we find a way to decrease the tensions and to support people.
Jeff, did you have a follow-up? You are muted if you do.
Oh, there, thank you. Shouldn't we at least try to modernize our military a little bit more?
Thank you for the follow-up. So we've been looking at how we can best support our troops, and I think that that's an important conversation, how we can support these workers, support these troops to have the training and the equipment they need to be able to do their jobs. There's also been lots of important conversations around how we can properly equip and train our armed forces to respond to the domestic crises that they're responding to in times of climate crisis, where we're seeing more and more severe weather. Military has been called in to provide supports on the ground for people in Canada, and we need to make sure that they're properly equipped and trained to do that. And so making sure that our forces are well trained and well supported and well resourced is something New Democrats are absolutely open to. But in terms of the question around our militarization in the context of the Ukraine, our approach is one of continuing to advocate for a peaceful resolution, continuing to advocate for pressures, fierce sanctions on Putin, targeting him and his allies and his associates to put an end to this war.
This is the last question that we have on Zoom. C'est la dernière question que nous avons sur Zoom. Jagmeet, if you want to go ahead and close the press conference.
Absolutely. I want to thank you once again, Bonita Zarrillo, our local member of parliament for Port Moody-Coquitlam, for all of her advocacy, her work in committee, but her fierce advocacy for the people of this community and for healthcare. And I want to thank Sarah and all healthcare workers for their incredible voice, for what they do, for being here, Mark, as well, for being here. I want to thank you. We're here for you. We're going to fight for you. We're going to fight to make sure our healthcare system remains public, well-funded, and there for you and your family when you need it most. Thank you so much. All right. Thank you all. That's great.
Thanks very much.
Thank